Co-production is the equal and reciprocal relationship between people with lived experience, the community, and health professionals. People with lived experience are the best placed to advise on what support and services make a positive difference to their lives. Across the Cheshire and Merseyside Musculoskeletal network, we recognise that our existing MSK services were not truly co-produced. Two trusts within the network undertook a collaborative pilot project focusing on the patient pathway within the MSK services. We focused on the early part of the pathway using an immersive situation technique in Meg's shoes. This supported us to walk people with MSK conditions through the pathway. Further resources detailing the approach accompany the recording for shared learning.
I led the implementation of the fibromyalgia pathway, and this was based on key areas identified by the co-production group. From the feedback, we ensured a personalised care approach was embedded throughout all elements, and we developed a steering group to oversee the development of the pathway. One of the ladies with fibromyalgia who was on the original co-production group was a member of the steering group, and it was great to get that constant feedback during the process of developing the pathway.
My name's June Davis, and I joined the co-production around 2022. So when I was diagnosed, I decided that I wanted to do some research. I ended up joining the pain management team, which for me was very successful. It gave me a broader outlook really on what fibromyalgia is. And it was from that the pain management asked me if I would like to join the co-production. Well, after the co-production group, which was quite a few different people who had fibromyalgia and was dealing with it, they asked me if I would join the steering group, which was a group of professionals, and I would be working with them, giving my views on what they was trying to do. I felt very pleased that they'd asked me to do that because I did feel that there was an area, a grey area for fibromyalgia sufferers that wasn't covered.
Following the co-production group in St Helens, we decided to focus on improving our care pathway for people with fibromyalgia. So people in the group had told us that their priorities were to have a rapid access pathway to diagnosis. They didn't want to wait for months on waiting lists or go between services. They also wanted to really understand their condition, and obviously they wanted to be able to manage it more effectively. However, there was a big gap between diagnosis with fibromyalgia and then knowing how to manage their condition to help themselves, and also knowing what was available in the community that may support them and help them.
We did want to continue with co-production throughout the whole of the pathway, and to do that we sought extensive feedback from people going through the pathway. We used that feedback to try and help modify aspects to ensure it was meeting people's needs. On completion of the pathway, we've seen good improvements in both clinical outcomes and patient experience.
My name's Janet Turner. I was first diagnosed with fibromyalgia about 6 months ago.
My name's Patty Lyons, and I've had fibromyalgia for a lot of years. I was diagnosed about 12 years ago.
Okay, my name's Anne, and my diagnosis was about 6 months ago, so I'm relatively new to fibromyalgia.
Well, my first appointment here was with one of the advanced physiotherapists. She was able to access all the blood tests that I'd had done with my GP, and it felt like she was taking everything as a whole. It made me feel like something was being done, where before I'd always felt like all these tests are coming back negative. Am I going a bit strange?
What the physios ended up doing was they took you at your pace. You were never under any pressure because there was other people doing it or, felt embarrassed. There was nothing like that because everybody in that room had the same thing. We were all there for the same reason. And so the exercises that we do, I still do now.
I was offered the opportunity to take part in the mental health sessions 6 weeks long. So I found it quite good because I took quite a lot away from it in terms of how to understand your body and to be careful what you did. It helped you to understand that it's okay not to be all right some days.
Coming here, being educated, understanding it for myself, it made me feel empowered. Empowered, definitely.
That's it. Knowledge is everything. It made me understand the condition. It made me realise that there will be things I won't be able to do, and there'll be days I can do things more than others. And it was so friendly. It was so accepting, and I enjoyed it.